So I'm just going to, there we go. Thanks, Belle, for that. Welcome to everyone who is with us tonight. We are very, very fortunate. We've got our lovely functional medical specialist. I mean, I'll let him introduce himself, but HB. So HB is over there in the tropical Cairns at the moment. So look, HB is here to run a special series with us for the next 3 weeks, and we really want to delve into health. Now, at the Global Wealth Club, HB, as you know, you run our health webinars fortnightly for all our members. But at the moment, you know, the world, as we know, in the last 2.5 years has experienced some, crazy times, and many people have been challenged in this area of their life, as well as other. Now, we teach sovereignty and we talk a lot about, you know, our wealth and keeping our finances protected. But this is a really good time to delve into how to protect our health, you know, how to look after ourselves. And if there is anyone who has such a great approach to health that is realistic, that is backed up, it is HB himself. So would you love to introduce yourself, HB, to everyone?
Yeah, sure. Hi, everybody. So my name is HB. It actually stands for Hoe Bing, as you can see on the screen. And the way that HB came about was I came to Australia to study year 11 and year 12. And when I came here, the teachers couldn't figure out my name because in Malaysia, we go by surname first. So it's like Lo Hoe Bing. And I never knew any different. So when I came over, I would introduce myself the same way. And then they said, what's your surname? I said, it's Lo. And I was like, why did you introduce your surname to us first? Like you're supposed to say, you know, I'm Jasmine Smith or Caitlin, whatever, right? And the teachers couldn't figure it out either. So after a lot of frustration, I'm like, well, just call me HB because those are the initials. You don't have to pronounce it. You don't have to sound it out. And everyone remembers because they go, well, it's like the pencil. I'm like, exactly.
I love that. That's awesome.
Yeah. Like my whole journey into medicine started with dad. You know, dad is a GP back home in Malaysia. Now he's a GP here in Australia, but he was trained in Sydney. So like big, long story. Essentially, I was born a little bit early. So I was born over in Darlinghurst. And after that, shortly after, we went back home to Malaysia, where I grew up for the first 17 years of my life. And you know, like the reason that I wanted to become a doctor was because of that, right? And I would see him when I wait at the clinic for him to finish. What I see in the waiting room are patients who are just like, oh, upset and downtrodden. And then they would go and have a consult. Then they'd come out smiling. And I thought, wow, that'd be a great profession to be in. So I decided that, all right, I want to be a doctor. And that was the entire basis of my decision. You know, it's like there wasn't anything that was related to medicine. In fact, I didn't even know what dad actually did. You know, like my experience of medicine from dad is falling over, cutting my chin open, and then being held down by 4 people while he stitched me up. Right? that's the kind of experience that I have. Then fast forward a little bit. I came over to Australia and I became the default masseuse for my badminton team. So I've always grown up having the ability to sense the body just from a physical point of view. And I could identify knots. I knew when they had been released. It just is something that I knew how to do, right? So I would help all of my fellow teammates, and then the basketball team would be like, "Hey, can you come and fix us?" And I was like, "Okay, sure." And knowing how to do that, and it's just taken me on a journey because I realized that there's much more to the body than what we just see, right? So lots of trial and error and experience. Later, I joined the functional medicine doctors group over in Melbourne and volunteered as a student and got to know that, wow, there's actually this whole world of medicine where it looks at the human being and the individual, and it helps us really track down what the person needs as opposed to a umbrella approach to just treating the disease as we see it, right? Really getting down and finding the cause. So a very simple example is when people get urinary tract infections, and then you go to the doctor and you say, why did I get this? And then they're like, well, we don't know, but here's some antibiotics, right? You can get rid of it. And we tell you nothing about trying to prevent it in the future or doing something to get your body in the best state possible, right?
Yes.
Yeah. So like lots and lots of experience have taught me that medicine doesn't know a lot of things, right? And to give you a bit of an insight, uh, I was at an immunology class, and the professor was teaching us about how the immune system works and all of the different things. And then I said, hey, what happens if you actually introduce a foreign body into the immune system before it actually matures? And he was like, well, then the body will learn how to actually tolerate the foreign body. I'm like, but if you tolerate it, then you're not actually sounding the alarm when the actual invader comes in later in life. And it's like, that would be correct. I was like, isn't that what you're doing with vaccines? And he was like, you're not allowed to ask any other further questions for the rest of the class.
Wow.
I was like, okay. So, my medical education taught me that there is one way to answer, and that is the way that you're taught. And that's what medicine is based on. We have procedures, we have protocols, we have guidelines, and you have to follow that. You don't, then that is to your detriment because you are now no longer part of the system, right?
Yeah.
Yeah.
Mm-hmm.
So there's a bit of a history behind that. It's just my personal point of view melded in with experience, and then just seeing the difference of results when you start looking at the person from their point of view, right?
Mm-hmm.
Like I vividly remember one of my first patients after I graduated from specialty training and going into GP land. We have someone who came in and say, doc, I have belly pain. And I'm like, this should be easy. It's probably a gastro bug. It's probably food poisoning. She said, I've had it for 8 years. I'm like, damn it. This is not going to be a walk in the park.
No.
And so I said, look, I can't think like a doctor because obviously she has seen multiple doctors over the past 8 years. So I said, okay, well, tell me about the body only has a certain amount of what do you call signals, right? You're thirsty for a period of time, and then you get a thirst signal. You encounter pain, and then you get a pain signal, right? So
Yes.
there has to be an inciting event that causes the pain. I'm like, all right, how long does it generally take for the belly pain to come on? If it's something from food, it's going to take, a couple of hours, 30 minutes at the earliest. If it's not from food, then it should be more immediate. So we started exploring that. I say, well, what it is, were you eating? And we found nothing with food. I'm like, oh, bummer, all right, this is going to be more difficult than I thought. So I said, what do you typically do when you get the belly pain? She said, it always seems to happen when I have an asthma attack. I'm like, oh, that's very interesting. What do you do when you have asthma? I use my puffer. I'm like, maybe you're allergic to your puffer. And like, when I said that, I was like, well, that's not in the, medical information that I learned when I was in university. I looked it up online. It's like there is no recorded cases of people actually getting abdominal pain from having their puffer. But I'm like, what have you got to lose? So why don't you go home, use the puffer, and then come back next week? Tell me what happened. Came back next week. She was like, holy crap, I get belly pain when I use my puffer. I'm like, problem solved, right? We change your puffer.
Wow.
Right? For 8 years, just because we're thinking in just this fixed box, right? To go, it can only be like the gut has to be food. No, right? Like, so once you deconstruct it and then look at the person individually and what they're doing, it's oftentimes not difficult to work out what is actually happening.
Yeah. I absolutely love, first of all, how you said what made you follow, this passion or profession was seeing people go into your dad's, rooms, like depressed and, sad, and coming out smiling. I think that's just really, really beautiful. But secondly, you're really talking about treating the root cause and, the root problems, because 8 years that that lady suffered. I mean, that's a long time. And I'm sure, please put in the comments here tonight if you suffered from health problems, and by seeing a fabulous functional holistic doctor like HB or, you know, kinesiologist, it's changed your life, because I have a story of my own that I experienced as well with that. Now, talking about the root problem versus, you know, just looking at the symptoms and this umbrella approach, how have you not given up, number one, from that moment that you got told to be quiet around the V word, vaccines? And I'm sure that's been a slightly hot topic for the last 2.5 years, would you say?
Slightly hot topic. Yeah. But I think I'm just stubborn. Like,
Good.
if I look back at my history, it's like I'm a person who just does not like giving up. Like, even when I'm wrong, I don't like giving up, right? That I have to beat some sense into myself. So the whole thing is that there is always a deeper truth, right? And when we encounter a problem that we cannot solve, it simply tells us that we do not have a good enough understanding of what the problem actually is, right? Because if you don't know the problem, then you can't solve it. So if you can't solve it, by definition, you don't understand the problem. And I also believe that every problem has a solution, right? So those two things are what keeps me looking. And then the depth of I don't know how you say, divineness of how we are created is so vast. It is hard to put into words, right? Like, I marvel at the human body, because when I see somebody who is sick in front of me, I don't see the sick person. I see that, how is it that you are still alive? It's because you have an amazing body that has kept you alive, despite all of the insults that have happened to it, right? Like, so we regenerate ourselves every single day, right? Every cell in our body is turned over within a period of about 7 years. Your bone maybe about 15, but every other cell within a period of 7 years is completely new, right? Yeah. And if you are building with an old blueprint, then you're just producing old cells. But you know, we have the capability to actually keep on rebuilding and build new cells, right? So there are all of these new stem cell therapies that are coming out. There are lots of ways that we're looking to enhance longevity, but they all come back to the basics, which is utilizing your own innate healing and regenerative mechanisms. And that is what keeps me going, because when you look at each person and how incredibly made we are, there's always hope, right? I think the best example of this is having cancer, right? Not saying having cancer is a good thing, but if you see people who have cancer and those who survive, they survive despite being poisoned, right? Being chopped up and being blasted with radiation. Or, right, out of the 3 methods which we use to treat cancer, surgery is the only one that doesn't cause cancer, right? The other 2 are known to cause cancer. If you have chemotherapy drugs, you cannot give that to anyone else. In fact, if you have chemotherapy, you have to stay away from other people, because your sweat, your urine becomes toxic, right? And you need to clean up the cytotoxic spill if people are actually, it's crazy, right? Like, if someone in the household has chemotherapy, depending on the type, you need a separate washing machine to wash your clothes because of the sweat that goes on it. But then it's like, where does that go? It goes into the sewer and then out into the ocean. It's like, what kind of thinking is this?
So back to front. And this is reality. This is the health system, especially we have in Australia. This is what we have to deal with. And what you said before, I loved how you just said you're stubborn and you don't give up. And we need doctors like you who are out there free thinking, but also you look at the root problems. So it's so good. Now you talk about, you know, mainstream, and you talk about working in, you know, doctors. Is it your own surgery, or do you work solely? Are you working up in Cairns?
Oh, here I work for a corporate GP practice, and there are about 12 of us inside the practice.
I can imagine you being very busy.
Oh yeah, we are very busy. It's good.
So how have you balanced with what you said and your knowledge, especially around, you said vaccines and chemotherapy, and how so many things in the medical field are poisonous, but yet they're still used. Is there still a place where you have to find a balance for your mainstream medications, and there's still a place for that versus more of a holistic approach? How do you personally deal with that, and what do you see happening at the moment, especially with COVID and what's to come? We know Mr. Billy Gates has lots of other nice viruses apparently he's talking about coming up. How do you have a balance when it comes to medicine versus holistic medicine?
Balance. Oh, I don't think there is a balance.
Yeah, no, true.
In it, it's very much dependent upon the individual that I see, right? Because at the end of the day, as a doctor, I'm there to deliver what is the most effective therapy for the person, right?
Yeah.
So if you do not believe that your food affects you, you are going to pay zero attention to what I tell you with regards to eating the right way, right? If you believe that antibiotics is the only way to cure your sore throat or your chest infection, you are not going to give up until you get antibiotics, right?
Mm-hmm.
So it's really very much, again, tailored to the individual. If they come in, they're open-minded. Like some people are at the edge, right? Because they've gone, I've been in this system for such a long time. And it seems like every time I get this problem, I get the same solution. Or like today, I saw a patient who came in for the first time. He said, I have been battling with abdominal pain for 10 years, right? The doctors have done colonoscopies, endoscopies, they've done all of these blood tests. And then do you know what the problem actually was? I'm like, oh, don't tell me, it's food. It's like, how do you know? I'm like, it's your gut. I mean, that would be my first guess. And he said, it's white bread. I'm like, great. So you stop eating white bread? He said, yes. But then the second part was interesting. He says, now I have wholemeal bread. I'm like, okay. And you're coming in because you have ongoing symptoms. He's like, yes, I don't have the crippling abdominal pain, but then I've got X, Y, and Z. And I'm like, do you think maybe the rest of your symptoms might still be related to the reduced wheat intake that you have? It's like, maybe. I'm like, okay, good. So let's do a test. Let's get rid of it and then see what happens to your body, right? So like a lot of patients actually have good instincts, right? They go, I've tried this. I know this works. When I do this, this happens, right? But then they don't have the full picture because they're caught up in some minute detail, right? So one of the things that I'm able to do is stand back because I don't care about their results, right? From not in a bad way. I like, if you want to sleep at 1 o'clock every night, it doesn't bother me because that's going to impact your life, right? But then I can look at that and then say, okay, here are the things that we can tweak without being attached to whether or not someone takes the action. Because at the end of the day, just like sovereignty in financial sense, you have to take complete responsibility for what it is that you want to do with your body, right? And you have to obey and listen to the results that it's telling you. Like you don't have a choice. If you're allergic to milk, you're allergic to milk. Like I'm gonna force milk down until I'm not allergic.
I'm gonna drink it anyway.
Totally, right? And I mean, later on in the series, we're going to talk about the power of the mind, and we have a tremendous capability, even just from a mental point of view, to create the reality that we want. So much so, you can have things that are bad for you and mask the symptoms at the same time, right? Yeah, but that is something that we'll go into a little bit more depth later on.
Yeah, absolutely. It's so simple, everything you're talking about, but so overlooked, HB. I mean, if everyone who's attending, who's watching, if you could put into the chat just a why, saying that you've experienced going to a doctor with a problem and or the healthcare system and they've treated you with, a blanket approach or just antibiotics. Did you ever get asked, any questions around your nutrition or exercise or the water? Because I can tell you 9 times out of 10, I never got asked myself. So I think the key, what you just said, it was about responsibility for yourself. And it's about mastering your own health, because clearly from the last 2.5 years, if we don't master our own health and we do not make the changes necessary, then the governments or the other bodies or other people will take care of our health for us. And clearly, from all the coercion and the things that we've seen, it's not really a good result. Would you say that's fair, HB?
Wow. Like, I think you get the results that you're willing to settle for, right? I think a
Yeah.
group like this is geared towards people who do not settle, right? Like, you get the answer and you're like, well, I don't think that's right, right? And then you push further. You go, someone else must have a different opinion. There has to be a different way to actually look at this thing. And it's what we talked about before. You're just not giving up. You're going, I can feel it in my bones that there is some greater truth out there, or that there is a solution, that I'm going to find a solution. And then if you keep pushing, miraculously, you get it, right? That's partly law of attraction, partly vibration, partly frequency. But at the end of the day, it is the human condition and how interconnected we are, right? Like, to me, like, intuition is simply that shared feeling that you have with someone else, right? So it's not just you and I do not exist in this world by ourselves, right? Like, my kids love watching David Attenborough, right? At the moment, they don't realize it, but what they're learning is the interconnectedness of life, right? That, oh, the big tree that grows in up in the, what do they call, the Daintree rainforest, right? Which has all of these medicinal properties, has grown centuries at a time. And then looking at what happens when the tree dies, it gets taken over by fungus. And then the fungus degrades all of the nutrients and then releases it. How does it release it? It actually produces spores. Those spores are carried by wind, goes up into the sky, form water droplets, and then are rained down onto the earth so that it spreads out, so that it's able to degrade more of the biomass that is around, right? Like, something so intricate and beautifully designed, it's like, it doesn't happen by chance. And the more we understand how connected we are to our environment, the less sense it makes to live in the kinds of cities that we have created as human beings, right? So I'm going off on a tangent, but like, I think it's important to realize that our separate experiences as an individual becomes very unimportant when it goes to the spiritual realm, right? Because at the end of the day, we're all connected in such a intricate way, we don't even know about it.
Yeah, the greater, mankind, everyone is connected, and with nature and everyone really. Now, everyone was saying that they agreed that they've experienced, a bit of a blanket approach here. I've just got a few questions in the Q&A box. Kathy, first of all, HB was asking, you mentioned a centre in Melbourne. What was the name of it again? Do you remember?
This is the Australasian College of Nutritional and Environmental Medicine, right? Like, that's awesome. who I first started off with.
Oh, awesome. Thank you. Kathy was asking. And Faye was also mentioning, how do you prevent UTIs? I don't know if it's something we can take offline a little bit, or if you want to give a bit of a blanket approach, not blanket approach, but just, a bit of idea around that. And then she also asked, how do I find a doctor who can assess the jibby jab injury, which we're going to mention that a little bit later. So maybe the jibby jab. I like that, Faye. Very direct and very
true. The heebie-jeebies.
Heebie-jeebie jab. I don't know if you want to mention anything on the UTI. You did mention that you do see a few people suffering from that.
Yes. So UTIs, well, I was going to say UTIs are very individual, but then again, it doesn't matter what condition it is. It's very individual.
Yes.
And I'll give you an example which is much easier to understand. So I have a patient who takes calcium supplementation, and I was like, you don't need calcium. You get enough through your diet. Like, in Australia, we eat enough green leafy vegetables. You'll be fine. And she said, if I don't take calcium, I get herpes. I'm like, I stand corrected. You need calcium, right?
Wow.
So whether or not so when I think about a person who keeps getting UTIs, we go, okay, right. Well, what do we need to look at as the entire person? Then we have to work with them systematically from top to toe. You go, okay, what are the most important things for sustaining life? First, we breathe. Second, we drink water. Third, we eat, right? And the order is in that is what air first, then water, then food, right? You die within 7 minutes of not breathing. You die within 7 days of not drinking. You die after 77 days of not eating. Yeah. So a lot of people would go, oh, it's my urine. I'll deal with water. Okay, maybe it's not the water that's a problem. Maybe you breathe really shallow and you do not get enough oxygen. Therefore, your body doesn't create enough free radicals to deal with the infection that is going to happen inside the bladder, right?
Yeah.
Like one of the things that people need to understand about a urine infection is that you actually get infected by the bugs that are in the urine, right?
Wow.
Those are the bugs that are naturally in your bladder. It's not like it came from somewhere outside and then invaded you, right? So you need to think about, okay, how do I need to maximize my own defenses? And the only way to do that would be to address each portion of your health, right? Your breathing, your hydration, and then your food intake. So that's the broad brushstroke, right? And then it's going, okay, what do we do with regards to breathing specifically? What do we do with regards to hydration? How much hydration do you need, right? It's about experimenting to go, okay, I get UTIs every month. Okay, when do I get them? Close to my period. Right. Why does it happen close to my period? What changes? Okay, where estrogen changes, where progesterone changes. Is it the hormone that is changing my skin? Right? Is it my hormones changing that changes my eating pattern? Is it my hormone changing that changes my sleeping pattern? Right? There are literally all of these little things that we need to consider before we can rule in or out certain factors, right? So I can't give you an answer to go, hey, take vitamin C, vitamin D, take prune juice, take this juice, right? And then you won't have a UTI. Like I might be lucky that you are vitamin C deficient and then boom, you get a miraculous result. But that would be literally like shooting in the dark, right? I'd literally just be lucky. Whereas if we peel back all of the layers, then we can say, okay, I can see what you're doing. And then when we test different things, I can see the results and what is actually, how it's changing your physiology. Then we can arrive at the final destination, which is your optimum health, because you didn't start off having UTIs, right? Something changed in your life that then predispose you to them. So we need to wind back the clock, so to speak, and get back to that state.
Wow, I literally feel like everybody just learnt so much just from you explaining the UTI and the 3 different steps that you talk about. Yeah, that was mind-blowing. I've never heard of it that way ever. Would you then say for those things like breathing, water and food intake, is that something that you generally always look at, for example, for other main health problems that people tend to have, which is very common, like fatigue, especially with the jibby jab, as Faye calls it, experiencing a lot of side effects, or really any health condition for people that are really suffering at the moment. Is that what the 3, steps and the elements that you look at first and foremost?
Yeah. Yes. Those are the 3 physical steps that we look at first, right?
Yes. Beautiful.
Yeah. And the simple way to actually test this is to go, okay, right? Like how many times do you breathe in the day? Like there are literally, 20, was it 20,000 breaths? I don't remember, but
Wow.
the amount of breaths is astounding. And if I said, okay, we're going to do here's a fun experiment, right? So we'll see what your lung or your reserves currently are just inside your body. So together as a group, what we'll do is we're going to take a deep breath in, and then we're going to let all of the breath out. We're going to take 5 deep breaths, and then we're going to hold. All right?
Okay.
So
I'm ready.
We go. Ready?
Okay. Yes.
Go. Okay. So deep breath in. And out. Second breath in. And out. Third breath in. And out. forth, in, out. Last one, deep breath in, all the way as deep as you can go. And hold. It's about 10 seconds.
Whew. That's all I got. I don't know if anyone else is longer. If you keep going, let us know.
I'm still holding my breath.
Wow. Okay. Go, Nadine. I know I'm not very good. Are you still holding your breath, HB?
Yeah, but I'm running out of breath. Almost done.
Wow. Vicky's still going. You go, Vicky. Go Team Vicky. Wow. Yeah, Bernadette had 10 seconds. Linda Lee, geez, she's still going. HB, you've got some competition here, man. You're going to have to practice before next Wednesday. Wow.
All right. No, but
Yeah.
so this very simple exercise actually shows you how you normally breathe and what your body is trying to signal to you. So there's several different parts. When we were doing deep breathing, did anyone feel kind of like lightheaded within the first 5 breaths? Like,
Oh, yeah,
put yes in the chat. If you're feeling lightheaded, then you were experiencing hyperoxygenation, which also means that you normally are not very well oxygenated.
Oh,
right?
wow.
Because
Wow.
your brain is like, what is all of this oxygen? And it's like tingling, right? And then when you hold your breath, you are looking to see how much carbon dioxide level you can actually tolerate, right? And as the carbon dioxide raises and raises and raises, then you get the urge to breathe, right? So if you can't tolerate a lot of carbon dioxide, that means you are relatively acidic, right? So
Wow.
you need to be able to get rid of that. And that makes you take the breath again and go. So it's a quick and dirty test to basically see, one, what's your breathing capacity like? And then it quickly tells us, all right, you know, how acidic you may be. You should be aiming to be able to do at least 30 seconds. You know, a minute would be fantastic to start off with, right? And then you build that up over time.
Yes.
Yeah.
Wow, what a simple and effective way. So when you said the hyperoxygenation, is that right? Did I say that right?
Yeah.
That was tough for a blonde girl. Say it slowly again.
That's great.
Wow. Would that mean that you typically are having like shallower, smaller breaths throughout the day?
Yeah.
So for people that possibly are carrying a lot of stress, a lot of, you know, maybe they've got Italian blood like me, where they tend to be a little bit more, you know, expressive and stressed out sometimes. Yeah.
Yeah, but it's because we have not really been taught how to breathe, and the stress response decreases your breathing and makes it shallow. Because if you think about when you are threatened, you know, think about horror movie and someone is trying to search the house in the dark, right? You don't have a person who's hiding in the corner going they're breathing very shallow and very slowly because they're trying to preserve, right? And that's the kind of image that I use. And you don't realize this because when you're breathing very shallow, what happens is that your senses get heightened, right?
Yes.
And then your adrenaline starts pumping. So with the heightened senses, you get the impression that you can focus better, that you can do more, that you're paying attention to more things, whereas you're actually scattering, right? Rather than focusing.
Yeah, wow, that was really effective. Everyone is saying that they loved it. Thanks for that, HB. Okay, now we have a lot of questions here, but we do have the next 3 weeks with you. So do keep asking questions. And if there's anything that you particularly really want to ask HB, please email support@globalwealthclub.com in the meantime, and we can make sure to prepare earlier as well. Now, as we know, we've gone through this pandemic, or people want to call it pandemic, whatever, and people have experienced COVID and side effects from the jibby jab. Now, what you said before about that blanket approach, you see floating around, take this amount of vitamin D, take this amount of zinc, take this amount of vitamin C to be able to, you know, protect yourself. What are some hot tips or some, you know, simple, effective ways people can really take care of their health regards to COVID and flus? And then if they have had to take the GB jab and had a side effect, or, you know, experienced something horrible, we're seeing a lot of heart problems or clots or stuff like that. What's your advice around that to be able to manage basically those side effects and get in good health?
Geez, there's a lot of questions.
Yeah, we'll break it down into two. Well, I guess it's a bit of a time. This is our intro one. Just share a little bit about your experience of what you've seen. And really, we know this is flu season, right? So how can we really just take care and master our health right now and tailor it to our individualism?
Sure. I think the most important thing to realize is that the past 2 years has taught you how to change what a viral infection looks like to the individual, right? And tend to be able to assign different symptoms. And what I mean by that is we've always had viral infections in the environment, and we're going to get them for the rest of our lives because they mutate to adapt to the environment and therefore continually pass around. So I'm going to give a few observations, right? When COVID first came out, I myself was shit scared, right? Because we're like, we don't know what this thing is. It seems to be really deadly. What's going to happen? And then we get all of these reports that, okay, so many people are dying. And then slowly there is this divergence whereby you go, well, that's strange. You know, the people who are dying are mostly old people. That seems to fit with the flu. And then it says, oh, it seems to be absolutely highly infectious. And then you go, oh, they say that if you come in contact with a person, then it takes X number of minutes before you become infected. And then very interestingly, anyone who then got COVID early on, you can see that, well, it didn't seem to spread the way that they were talking about it, right? So we were getting divergence of information and what it is that we were seeing in real life. Now, from a clinical perspective, what I noticed was a few things. And because we have such a diverse audience, I'll give you some very unusual things that I picked up. When COVID first came out, within the first month, we had an antibody test for it. And an antibody test is like, hey, let me test you for Hep B. If you have the Hep B antibodies, then you're immune to Hep B. I'm like, that's weird. This disease literally is supposedly a pandemic, but we have an antibody test to see whether or not you've been infected by it. Like, how did they get the antibody, right? Like to recognize it, you first need the original substance to then say, okay, this binds to it as the antibody, so you must have that. So that was the first thing. Second thing is, within a couple of weeks of it being released, you know, if you actually ordered the test, and as a GP, you could be fined 40 grand. I'm like, wow, how come we are being, if there is a test to see whether or not you actually got the thing, doesn't it make sense to use the test? Then they were saying the test is useless. You can't actually use it. It doesn't actually tell you immunity, right? Like these were the things that were being told. And I'm like, oh, that doesn't make sense. And then within a few months of the pandemic, it used to be that when you order the COVID test, then you actually get the whole respiratory panel, influenza and all of the different things. They decoupled those tests. So then they no longer tested for everything, right? They just tested for one thing. And you go forward in time, then last year we had 0 flu deaths, right? In Australia. And it's impossible. It's statistically impossible to have 0 flu deaths. That is assuming that one, there's actually no flu, or if there were flus, it was not lethal in anybody, right? So my college actually said, hey, we had 0 flu. Why is it? Must be because people are washing hands and keeping their distance. Wow. Okay, if it was that easy, then surely we would be seeing the same thing this year, right? But the hospital is filled with influenza A this year already, and we're only at the start of the so-called flu season. We're seeing people getting all kinds of viral type infections, right? And it's already started just like the normal cycle. It's a little bit exaggerated because people haven't been mixing, right? And therefore the immune system is a little bit lagging because it hasn't had the practice, right? When we come in contact with people who have different diseases, our body is constantly sampling the environment and then going, okay, I recognize that, I'm not going to let it take hold. I recognize that, I'm not going to let it take hold. But you give it a big gap, then suddenly it meets it and it go, I don't remember seeing this particular organism. I'm just going to wait and then see what it does. Then you fall sick, right? Then the body learns again and it says, okay, let's memorize that so that we don't let that happen again, right? So a few of the suspicious things that are happening, basically then you add to that different types of symptoms that people have been experiencing, then you can create essentially a new entity by itself. We say, okay, if you lost smell and taste, then it's definitely COVID, right? It's like, wow, it has the highest correlation with the positive test, but it just tells you that it's likely to make that particular test positive, right?
Yeah.
So I don't like to look at diseases as individual things, right? Like if you have, again, a lung infection and it's a specific type of pneumonia, I don't go, all right, it is that particular bug that is causing the problem. It is what is happening in the host body that has been broken down. Which part of the defense system is not functioning well, which needs to be addressed, right? So if we think about what we can do for ourselves, right, and don't worry about other people because they're going to do whatever they're going to do, right? If they're sick and they want to cough at you, if you have a robust immune system, you don't care. If other, like at the end of the day, that is the big thing. Your immune system functions 24/7, never shuts down. It's always doing its work. As long as you support it, then it is going to work for you. So generally speaking, a respiratory problem is going to start with the breathing. Again, same thing, right? Like we've just shown within this exercise that majority of people don't even breathe properly. So you're already starting behind the 8 ball, right? In summer, you're like, hey, summer, I don't get a chest infection, but then in winter I do, because in summer, you don't have the added cold, which shrinks your airways and makes you more congested and therefore blocks up and allows you to actually develop an infection. Whereas if you learn how to breathe properly, that might not be a problem in the first place, right? So we need to identify where the break in the chain is. Okay, is it your breathing? Okay, all right, it's not your breathing because you've done lots of meditation training. Fantastic. All right, is it your hydration? How much water do you drink, right? Dilution is the solution to pollution. If you think about being invaded by a bacteria or a virus as pollution, then you just dilute the heck out of it. Just drink water. You should be peeing like a trooper and your water in should be the same color as the water coming out. Then you are totally and fully hydrated, right? And taking care of that. Then the third part is then looking at your nutrition. This is where people use all of the different supplements, vitamin C, echinacea, zinc, whatever, right? But from a dietary point of view, just like when you get sick, well, when I won't say you, but like, let's say an animal gets sick. When an animal gets sick, one of the first things they do is they stop eating, right? Whereas in our culture, as human beings, we're like, I'm feeling a little bit under the weather. Let me eat to make myself feel better. And they typically eat ice cream or some other junk. And then eventually they fall sick, right? And then they eat more of the same thing. So you look at, okay, so from the food point of view, what can you remove that is going to be much more beneficial, right? So what are the heavy stuff that you're eating that requires you to digest, right? Because digestion accounts for 30% of your basal metabolic rate, right? 30%. If you don't eat, you free up 30% of energy that can then go and fight all kinds of different things, right? So you think about if you've had COVID or you've been seriously ill, like appetite is one of the first things to go, right? because it's like it needs to maintain as much energy as possible to fix itself, right? And that sort of leads into, okay, from a food point of view, intermittent fasting has a much better effect from a long-term perspective, not just when you're dealing with being ill, but also optimizing your health moving forward, right? So again, those three things as a basic outline. But from a disease point of view in winter, your expectations are going to play a big role, right? Like when I see patients and they're coughing and spluttering, one of the things that's been happening in my clinic is that, oh, they go, oh, you have flu-like symptoms. No, we can't see you. I'm like, as a doctor, I'm like, I don't care. If you have flu-like symptoms and your child needs help, like come in, right? They put them in the isolation room. And I'm like, I'm going in, I'm not going to wear a mask, right? Like if I'm going to get sick, that's my problem, right? But when you're constantly exposed to all of these pathogens or all of these different things, your body learns. Your body learns that, hey, I need to up my defenses when I'm in contact with these kind of things, or I need to be wary, and then I need to adjust how much I am resting. And it gives you clues, right? So when I go home, I'm like, how is my body feeling? Do I, you don't get to the end and then go, oh, I've got a scratchy throat, I'm going to get a sore throat tomorrow. Like you have many signals before that, before it goes, Ray, DEFCON 1, we have a problem and need to ring the alarm bell, right?
I love it.
Like there are much more subtle signals. So if you pay attention to those signals, you're able to intervene much earlier. That's a very long-winded way of saying your psychology is going to feed in much more to your health during this period of time because it influences your behavior in very subtle ways, right? Like if you believe you're going to get sick, you're going to start behaving like a sick person before you get sick, right? So that's again a different portion, but a very important one in winter, right? If you believe you're going to get sick, you're going to get sick, right? And it can be something as simple as every time it's winter, I get a flu or I get the cold or my nose runs. Well, guess what? Your body has just received a command. It goes, is it winter? Check. Yep. Do you have a runny nose? No. All right. We better remedy that, right? So you get a runny nose. And then it's a self-fulfilling prophecy.
Brilliant. Yeah. That was awesome. I feel like I just feel like the intent of us listening to you is very deep. It is with me. I'm loving it. I do feel like what you're talking about though, believing and your mindset, you're definitely going to go a lot deeper into that in the next couple of weeks, because you said it's just as important part, correct?
Yeah, it's crucially important because it's what drives, like our mindset is so important. It drives the unconscious portions of our being, right? Like we used to think that there is the autonomic nervous system, which is controlling everything else that we do not think about: our breathing, our digestion, our immune system, right? And science is finding that is not true. With focus and intention, you can actually shift the results of all of those things. You can control your breathing. In fact, you can shift the rate at which you're breathing at will. All of us have the ability to do this. But you can train your body to breathe at a different rate, right? At a different depth. You can train your heart rate to come down by taking a particular kind of breath. You can train your blood vessels to relax, right? Now, I don't have control to be able to open my blood vessels, but I know that
you got to get better then.
Yeah, that's right. I've got a lot more practice to do.
You got to practice that.
Like people can actually shift the temperature of their palm, right? Like I have no interest in doing that, but I do know you can actually train so that you shift the immune system response, right?
Wow.
And just through breathing. And this has been proven scientifically, and you can do that by training for about 8 hours. And then after that, you have that skill for life. The issue is then applying it when you don't feel well, right? Because when we don't feel well, that's when we revert to the lowest common behavior that we have, which oftentimes is just very old bad habits.
Yeah, couldn't agree more. This is awesome. Frank, we'll take your last question and we'll wrap it up with a few bits and pieces and explain what's coming up in the next few weeks, as we like to keep Wednesday within the hour so people can replay. So what is your view on aging, wear and tear on joints and ligaments, etc.? Can such damage be reversed by diet and lifestyle? So Frank has asked that. What do you say on that, HB?
Yeah. And so, Frank, the answer is yes, of course. Your body is constantly in a regeneration cycle, right? We are not machines, so it's not as if you use your legs for X number of years and then it wears off and then you get new ones like tires, which we can't, right? Like you can get a knee replacement nowadays, but that is the use and throw away mentality, right? If you are having your cartilage wear out, then my question is, why didn't it wear out sooner, right? If it didn't wear out sooner, what was happening before that allowed you to regenerate sufficiently quickly versus now? And you say, oh, well, I had a football injury when I was younger, and then since then my knee has never been the same. Fair enough. That means when you injured your knee, you didn't do what it took to actually get that knee back to its 100% functioning capacity, right? You actually allowed it to develop some deficit, and then that deficit has gotten bigger over time, right? So this is really common. I'll give you an example. So a 76-year-old lady came to me. She was on walking sticks, and she's like on morphine, like 3 different pain-killing tablets. I'm like, man, if I took your painkillers, I literally stopped breathing. And she's like, without them, I can't even get out of bed.
Wow.
I'm like, okay, how long has this been going on for? 15 years. Okay, cool. And what has been happening? All right, there was no special trauma. The cartilage has basically been ground out completely, but you know, she's too old, so she can't have a knee replacement. Okay. Well, what's your diet like, right? That's where I ended up with. And she's like, I eat all these things. And I'm like, cut out wheat completely. She's like, I eat that for breakfast every day. I'm like, cut out wheat completely. And if I'm wrong, you've lost a couple of weeks of your life eating stuff you don't like to eat. But if I'm actually right, then you're going to gain something quite miraculous. 1 week later, she had reduced one of her medications. 2 weeks later, she was off her walking sticks. A month later, she had been off all her medications, right? Like, because she cut out one thing in the diet. And that is an example of when wheat was the problem, right? For a different person, that would have done nothing, right? So finding out what it is that is causing the problem and then really looking at it is, yeah, like you remove the cause, the effect disappears, right? So you just want, you think about your body as like a bank balance, right? If you put X amount of dollars in, you're going to have X amount of dollars to spend. If the number of dollars is dwindling while it's inside the bank, you have a leak somewhere that you need to plug, right? So that's where we put on our detective hat and then go, okay, where can I look, right? Like the only benefit that I would bring to the table is I have seen so many of these cases and I know where to actually look. So it is easy for me, right? Like if you've never encountered these situations, you go, I never think of looking at that. I'm like, oh yes, I didn't before until I got trained, right? And then after that, life is the one that provides the experience. Like people keep bringing new stuff to me. Like, I have no clue what you have, but well, I'm curious enough. So let's figure it out together.
Wow. If only every doctor was HB, the world would be even better. That's awesome, HB.
We have a lot of weirdos walking around. That's all.
That's it. Who here has really enjoyed listening to HB tonight, share from his experience, and also at the end of the day, really just getting to the root cause. And the next couple of weeks, we're going to go more in depth what you talked about. Do you want to share a little bit more about what you're going to be covering over the next few weeks, just so people know to yeah, that's awesome, Deb. To bring people along, because we really need to be empowered in every area of our life and health. If you have wealth, if you have, you know, everything else, but you're in poor health, I mean, what good is it to us at the end of the day? So what are we going to be covering in the next couple of weeks, HB?
I have no idea.
Pretty much, me too.
Look, I think a great thing about this particular series is the dynamic nature of it, and then seeing what it is that interests people, right? I think we have a common place to work off. So if the audience can think about, all right, there are questions that I would really like answered, then that is a good place for us to jump off and then go on a tangent, right? Like we can talk about vaccines, we can talk about trying to recover from it, but I'd rather tailor it to what you guys have in mind as opposed to what I have, right? Because what I have to talk about might not be interesting at all.
I doubt it. Just based on the energy tonight, everyone is extremely in deep with you. They love it. No, that's a really good point, though. And if there is anything people have particular, questions or worries or wanting to know more, reach out to the team, or like we did tonight, ask questions live. I'm sure HB is happy to be put on the spot.
Yeah, absolutely.
No
and
sweat. You don't give up.
Not rehearsed. That's right.
It. Yeah, so even if you don't know, you're going to find a way to know, but I'm sure you will. All right, so there's a few more here. Darren was just talking around neurological disorders. So we're going to probably speak about this in the next one, especially FND. So if you know stuff about that, HB, I'll send you. And also really around supporting our immunity. So yeah.
What is FND?
I have no idea. Darren, what's FND? Let us know. But yeah, we'll functional neurological disorders. I'm proud of myself for reading that.
That's great. That basically means they don't know what is happening medically, and they say it's functional, meaning it's you and you're crazy, right? Like that's you break down the words. That's all it's saying. We can certainly handle that. I've got a case kind of like that, which is quite interesting. But back to I wanted to leave everyone with being curious, right? Like at the end of the day, I don't know everything. Shock, horror, that's such a surprise, right?
I believe it.
But no one does. No one does. The great thing is that you have access to the internet and you can search for almost anything that you want. So like I had a patient who came in and he had warts all over his fingers, and we're talking about it, and he is a professional kayaker, and he was in severe pain. They've been treating it, we're using surgery, doing all kinds of things, but it keeps coming back, right?
Yeah.
So after treating him for a couple of sessions, I'm like, I am clearly not making a difference to you. I am happy to take your money, but like, this is just going to continue on, right? So give me a week. Let me go do some research. And then next week, if I have something, then I'll share with you. So I went to the literature, did a bit of a search, and then it says, hey, zinc actually helps prevent infections, particularly viral type infections. So went back to him and then say, hey, look, if you use zinc and then you use this other substance called quercetin, then that's going to allow the virus to stop replicating and it should disappear. Now, the downside is that you have to take it for 1 to 3 months. It's like, I'm down, I've had this for like 12 months. After a month, it's like, look, they're gone, right? Wow. Then since then, I've been using it for my skin cancer patients who have lots of warts, right? Like previously, I didn't know what to do with them. Now we can actually have a treatment. Wow. And on that note, zinc and quercetin are non-selective for viruses. So guess what it also works for? Every other virus in town, including COVID.
Yes.
So if you're thinking of taking a supplement, zinc and quercetin is a good place to start. But again, same thing, right? As an individual, you need to assess what you need. Don't just because it's a good story, don't just go out, start it, right? Like if you're experimenting, fine, you go, and you know how your body actually reacts. That's a great place to start. But don't just think that because you are using it, then you're cured and you won't get an infection, because that's not how it works.
No, absolutely not. And people need different amounts depending on, your body weight, your general health. So I think it's important to, take into consideration. Okay, excellent. So HB, this has been absolutely awesome. I mean, I've learned so much myself, and next week we're going to be going into the next topics. I've let people know that they can reach out to us if there's anything particular, so we'll let you know prior. I know people are going to reach out to us and ask, so do you offer remote consults? And I know we do have a program coming in this place, so, you know, stay tuned with HB because he's a wealth of knowledge, and we really do want everyone to be empowered in their life, in their health, because without your health, as we've said many times tonight, really everything else doesn't matter. So yeah, how can people, well, it matters, but you know, it's really your life matters, okay, but it's really important to master your health and look after yourself so you can enjoy all the other things in your life. So how do we reach out to you, and are you absolutely happy for people to do remote consults with you if they're not in Cairns, which Frank, by the way, said he is in Cairns and he will come and see you.
Great. No worries.
Frank Burton, so yeah.
Yeah, no, absolutely. You know, happy to do remote consults, and then we can have a bit of a chat. I only caveat there is that all I can provide you is information. I can't actually take you on as a patient or as as your regular doctor, so to speak. There's jurisdictional issues and registration issues tied to that.
Absolutely.
One of the things I think would be useful is that they are more than welcome to hop onto the Exponential Health Telegram group, right? Like my private Telegram group, they can come on and get the details from Global Wealth Club. And if you have questions and things to share, that's a good place to start.
Yeah, just seeing if anyone has the link right now. Otherwise, we'll send it through in our follow-up email for next week. Yes. Yeah, we'll do that just in case we don't have it in time. All right. Well, thank you so much, HB. Everyone, thank you so much for coming. How brilliant has tonight been? I honestly really learned a lot. And who's going to commit to just breathing a little bit deeper and maybe doing those 5 breaths a day? Because I am. Awesome.
That's good.
Thank you so much. Yeah, everyone's saying that they're going to be breathing a lot. So next week we'll come all relaxed, more oxygen to the brain. Awesome. What was that comment about jurisdiction, Faye? So HB was just talking about if you do consults, you know, obviously depending on where you are, he can't necessarily take you on as a patient, but you know, it's about information and being educated in that space. So I'm sure we can take on more of a different question if it's a little bit more particular to you afterwards. Okay, thanks so much, HB. So we're going to see you next week at the same time. Thank you. Have a lovely night, everybody. Stay in good health, and we will see you next week. Take care.
Bye, everyone.
Bye. Bye, everyone.